This is Your Health, a podcast of the Integrated Health and Social Services University Network for West-Central Montreal.
Hello and welcome to Your Health. I'm Barry Morgan. CIUSSS West-Central Montreal has had, since recently, a new complaints commissioner, also known as an ombudsman. Her name is Maude Laliberté. The complaints commissioner is mandated to receive and examine complaints concerning the health and social services offered by the CIUSSS to its patients, users, and residents. Well, to further explain her role, I have the pleasure of welcoming Maude Laliberté to our studio. Hello, and congratulations on your recent appointment.
Thank you very much.
You're very welcome. So first of all, Maude, what exactly does a complaints commissioner do?
The complaint commissioner does a lot of things. The first role is really to ensure that the rights of users are respected when they seek to get care and services through the network. The other role is also to ensure the quality of services for the overall system, so for all the users. When someone comes to meet us or to share with us their dissatisfaction, can be done either by coming to the office, calling us, or sending us an email. What we'll do is we'll examine the situation, we'll see how we can find solution to help the user, but we'll also try to find solution to improve the system. We're not only there to help examine complaints, but we're also there to help navigate the system. The system is very complex and it's hard for the community to know where to go, how to move from one facility to the other, how to navigate all this. So we're there to support users and community also.
So if somebody wishes to make a complaint, they simply, as you said, contact you either through email or call you and just let you know, here's my issue, and then you go from there.
Absolutely.
I see. And would you describe your role as being neutral between the CIUSSS and the complainant?
Absolutely. The Ombudsman's office is named by the board of directors, so we're not part directly of the establishment. We're neutral towards the establishment and neutral toward the patient also. So we want to see what happened in the situation, to do a critical analysis of the situation and make sure we can find solution so that the situation does not happen again and again to other users, to improve the system.
You're kind of like a judge, I guess, in that respect, that you're not siding with one or the other going in. You have to maintain your neutrality and you act accordingly.
Yeah, but our mandate is different. Our mandate is really the quality of care. So we focus on that. We're not there to assign a blame to someone.
You're looking for solutions.
We're looking for solution and improvement in the system.
Would you say there's a large volume of complaints handled by your office? Yes.
Yes. We've been busy. We've not been busier than other CIUSSS, but we're busy, definitely. And this is quite stable through the years.
It's natural, I guess.
Yeah, we have a bit more assistance than complaint. Assistance for us is when we help people navigate the system. So a lot of people reach out to get our help.
How do you handle the volume of complaints, considering there are a number of establishments within the CIUSSS, thousands and thousands of employees?
Absolutely. Well, I do not work alone. I have a fantastic team. So we have technicians, we have delegates. A delegate is someone who's going to carry the examination of a situation like I would do. So we are many staff people and we try to be accessible and to go on different sites to meet the user.
Can you perhaps, obviously without naming any names or any specifics, can you give me an example of a complaint that you receive and sort of the steps that you might follow and how long it might typically take to get to a resolution?
Okay, so let's say you're at the hospital. Your mom is at the hospital.
Okay.
You're a family member. You're worried because she's not getting the care you wished her to get. You would like the OT or the physiotherapist to be involved, and that has not been done. Your mother's not walking. You might reach out to the Ombudsman's office to see how you could help improve the care of your mother. The first step will tell you to go and see the head nurse. So to see and talk with the staff, talk to the head nurse, because they are the best one to give you solution that would be very immediate. If you're not satisfied with what happened with the head nurse, you can come back to us and we're going to examine the situation, meaning we're going to look in the chart, we're going to talk to the staff, we're going to look at the policies to make sure that everything was done in the standard of care. If it was not, we're going to suggest improvements so that the situation does not happen again.
I see.
If your mother is not there anymore, if your mother is still in the hospital, we're going to try to implement measure quickly so that she can get the care she needs.
What would you say is the most common complaint that you receive?
Well, we have three main topics that come very often.
Okay.
The first one is related to quality of care. That can be error in medication, that can be complication following a surgery. The other problem is related to communication. Can be an issue between the user and the staff. Let's say something can be perceived as lacking of empathy or lacking of respect. Can be communication a bit more organizationally, meaning the staff is not sharing critical information about the care between the shift or between departments.
I see.
So that's another issue that is pretty common. And the last one that comes often is lack of access. Obviously, there's more requests and demands to get care than the offer. So maybe there's some waiting time before accessing to the care you need.
I see, I see. What would you say, Maude, is your goal as Complaints Commissioner, as Ombudsman now for CIUSSS West-Central Montreal? Do you have a specific goal, I guess a vision perhaps?
Absolutely. The first goal I have is to be accessible and being visible.
And to make sure people know that, I guess, right?
Yeah, that people know that they can reach out to the Ombudsman's office. A lot of users that are not satisfied do not complain. So I think it's close to 87% of the unsatisfied users that do not complain.
Is that right? Why do you think that is?
For many reasons. Sometimes people feel it's not going to change anything, so they don't want to bother doing the process. Sometimes it's users are a bit vulnerable. So if you are followed by, let's say you are in a CHSLD, long-term care unit, you are pretty dependent on nurses, PABs. So sometimes you feel a bit too vulnerable to complain against one of the staff that is caring for you every day.
They might feel there's some sort of reprisal in some way.
Yeah, absolutely. So that could explain why people do not complain. I want to make sure, and the other reason, maybe they don't know we exist. So they're not aware that such system exists. So I want to be there, not only me, my team. So we have delegates to make sure that when people have dissatisfaction, they can have someone to talk to so that we can support the community.
What made you decide to take on this role?
I'm a physiotherapist. I'm a trained physiotherapist, but I'm also an ethicist. And through all my career, I'm always wonder what was the factor that influenced the care we were giving. And I always felt that the human side was so important. The relation that you establish with the patient is central. I've always wondered, how can I improve quality of care for patients? How can I improve the system? So it's why slowly I came to the Ombudsman's office after a PhD in bioethics. So I did some studies and here I am.
I guess you knew from a while back, or since maybe you were much younger, that health was somehow, working in public health was somehow in your future.
I'm not sure if I knew, but yeah, that's something that always interested me to help people, and I want to help the system also. So I want the system to be as good as it can get, as I'm a user also, so I want to have the best care also for myself and my close one and the community, so that's something that's very important for me.
Well, it's a pleasure to meet you, and thank you very much, and congratulations again.
Thank you.
That is Maude Laliberté, Complaints Commissioner, Ombudsman for CIUSSS West-Central Montreal. And that's it for this edition of Your Health. Thank you for your time. To hear our previous programs, you can find them at podcast.ciusswestcentral.ca. That's podcast.ciusswestcentral.ca. And let us know if there's a topic you'd like us to explore in the future. I'm Barry Morgan. Until next time.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.